Great, we're live. So hi everyone who's joined us already. I'm just going to give this a couple of minutes because we are just bang on 3 o'clock. So if any new joiners are coming, I'll just give that a moment. I hope everyone that joined us had a really lovely Easter and did manage to take at least a little bit of time off. So before we get started with the interview with Trudie, I'm just going to run through a few things for the webinar today. Now, first of all, if you joined us last time for our webinar with Claire Sutton, welcome back. You'll already know the format of this. Hi everyone who is in the chat box already. Hi Charmaine, hi Kim, hi Debbie. Thanks for coming along today. I just want to check if everyone can hear me okay. So if you can, just pop a yes into the chat box. And Trudie, if you could just say hello too, we can check everyone can hear you as well.
Hi, can you all hear me okay? It's very nice to be here. Thank you for the invite.
Great. Thank you for coming along. Great. That looks like everyone can hear, which is great. Cool. Now, if you have any sound issues either now or later on while we're going through, just pop a message into the chat box. We do have some of the team at Birdie who are going to be on standby. So if you need any help, they are there for you too. So before I let Trudie introduce herself, just while everyone is joining us, I'm just going to run through the reason why we're doing this webinar today and kind of set the scene for before we get into the interview. So at Birdie, we're working on a number of initiatives to help the care industries, and these webinars are just one of them. We do have a few software initiatives in place as well, and later on in the session, I'll run through those quickly for you. But most importantly, the reason we're doing what we do is to build a collaborative network where we can all share our ideas, we can work together and we can ask questions. And I think given the uncertain times that we're in at the moment and the unprecedented challenge ahead, now is a great time for us to learn from each other. And by talking about our problems openly and sharing experience within the industry, that's how we're going to move forward. So that's the purpose of today. And that's why we've invited Trudie from BelleVie to come and share her own experiences. And like I said before, this forum is supposed to be collaborative. So I really do encourage you to ask questions as we go along into the chat box. And I'll get to those if we can while we're going along. And if not, then at the end of the session, we'll try our best to answer those. So now we are already 3 minutes in, and I'm sure that you'd like to hear from Trudie, seeing as she is our guest speaker. So first of all, I'm really excited to introduce Trudie to you all. She is the CEO and founder at BelleVie Care. So Trudie, can you just introduce yourself for our listeners and tell us a little bit about BelleVie Care?
Yeah, sure, of course. Thank you for inviting me today. It's a pleasure to talk to you and everybody who's online. So myself and my co-founder VLN, we founded BelleVie because we wanted to do something different in home care. Years ago, I worked as a care worker and have seen the reward and sense of purpose that great care work can provide. But I've also seen some of the difficulties. I then went and worked in lots of other different spaces and came back to care work. And VLN and I were both really inspired by the model of nursing in Holland called Buurtzorg. And they use small self-managing teams of nurses, and it's now moved to care as well. And it's been incredibly successful over the last 13 years. And it's all about empowering and valuing care workers. And so BelleVie was founded to apply a Buurtzorg-inspired method of an operating model, and to really value the people, the care professionals who do this amazing job every day, and empower them to do more, take more responsibility, and in return pay them fairly, pay for guaranteed fixed hours rather than pay them a salary rather than pound per hour. So we're changing things. We're doing things quite differently. We have a monthly membership rather than charging per hour. And we're trying to innovate in lots of different areas and building the tools that we need to do this. And on top of that, we've now been faced with a global pandemic, just in case we didn't have enough to deal with.
Yeah, just in case there wasn't quite enough going on at the moment anyway.
Yeah, 2020 was quite a busy year already before this happened.
There's a few things you mentioned in there about BelleVie, which we will get onto later, about like the self-managing teams and things. So I think the best thing to do now is to jump straight in, and let's talk about the challenges that yourself and I suppose the whole kind of all of your staff have faced due to COVID-19?
Yeah, yeah. Well, yeah, I mean, overall, it can be summarized as change, just a huge amount of change in a short period of time. So we've in the people we support, we've had some people who've chosen to leave us, particularly those who are were more companionship type packages, because they're worried about people coming to the homes. But we've had other people who need much more support because, say, their family are self-isolating. Friends and neighbours, who often older people over 70s now, can no longer help out, so they asked us to do a lot more. Hospitals discharging people super quickly and desperate for home care packages. So just huge change in the people we support, and then changes in the team. People with a vulnerable person in their household, who've been really worried about being at work, people who've shown symptoms and self-isolated, recruiting replacements, so the people have gone up and down. The rota has never seen so many changes. But yeah, it's just been a huge amount of work to stay on top of things and make sure that we're still delivering a high quality care.
I think that's something we're hearing across the board. It's change, isn't it? I mean, there's just so much to deal with at the moment. So Trudie, can you kind of tell us, what does a day in the life of you look like?
Well, I suppose there's kind of, for us in the central team, and then there's also for the care professionals who work for BelleVie. So because we work slightly differently, there are more roles that are done by the team rather than by us, that might, the sort of things that might traditionally be done in an office for another home care provider. So for the team, their day would usually start by looking at Slack, which is an enterprise-wide comms tool, a messaging tool, which I know Birdie uses as well. It's often used in tech companies. But that Slack's been brilliant, and especially with so much change happening. But one thing I've noticed, our usage of Slack has gone up since coronavirus, and there's about 2,000 messages a week from one team.
Oh wow!
Yeah, so the day will start with for one of our care professionals looking at Slack to see, if someone's off, can they swap shift? So the team owns their own rota. They agree with that themselves. So if somebody can't work, then the team work out between them who can cover and what to do. They also use Slack to support each other. They'll share good moments in our moments channels, things that have happened, and they support each other through the good and the bad times. Then when they'll have caught up on things on Slack, and then they'll go on shift. They'll use Birdie to see what visits they've got coming up. Our rota syncs with Birdie, and they'll record their visits in there, and obviously they can read the notes from previous visits in there. If it's a Tuesday like today, the team are currently in a team meeting. The weekly team meeting, which has all moved to video call now instead of face to face. That was the first thing we changed, actually, because we thought, well, if one person has symptoms, we realised, we traced back to everyone they've been in contact with. If they meet face to face on a weekly basis, then take everyone in a whole team. So that moved very early to video call, and but we were a paperless office, a paperless setup, and an office setup already. So actually, that's working remotely hasn't been too challenging for us. And yeah, that's a day in the life of one of our care professionals.
That's cool. I think something you just touched on as well is the fact that your care teams manage their own rotas, and that's the idea of self-managing teams.
Yes.
And how does that kind of cascade down from you? So do you choose the teams, or can you just explain a bit about how that works? Because for some, this will be really important to them. Yeah,
we appreciate that it's a bit different, and there's lots of stuff that we're working out. We're still quite a young company. We're only a year old. So in terms of recruitment, so the data from the team will tell us whether the demand needs more supply, so whether we need to recruit more. So in the central team, we will do Facebook ads are a really good source for recruits for us. So we'll do things like that, design the adverts, manage the Facebook campaigns. But then and we'll filter through messages to take some of that grunt work off and to make sure we're responding early. But actually then the team are involved. So we have a local recruitment coordinator in the team. So they all take on extra roles as well as the care work. And they will do initial phone calls with somebody and say whether that person feels like a good fit. And then before coronavirus times, we'd meet them, and if there's a few together, we might meet several together with a couple of team members. So they're very much involved, and it's their decision. If it's not the right fit and they say no, then that's their decision. The registered manager will be the one to sign the contract and agree the hours. So the legal side of things, the buck stops with her. But yeah, the team are involved in everything like that. So it's very much the philosophy we adopt is the servant leadership philosophy, where our role in the central team is to serve the teams. So our job is to enable them to deliver the best care. So that's either buying or building the right technology to allow them to work, making sure that we can bring on new people to support, and that our recruitment campaigns, national branding, things like that, all those sorts of things are done. But it's all to serve their purpose.
That's really cool. It's a really nice way of doing it. I think, it gives the carers a lot of value as well. They have these other roles and they decide their rotas. I think that's a really nice idea that a lot of people should maybe look at implementing, especially given this whole situation, but as well outside of that. So the next question I have for you, it kind of fits into this idea of self-managing teams as well. Where do you find the information, particularly about COVID-19? But if you are sharing it, does that come from you or does it come from the team with the clients? I mean.
So we agreed across all of us that we needed a clear comm plan, and rather than sending lots of messages, we agreed that our registered manager would send a weekly email to the people we support and their families, just to say what was going on. Weekly seems to feel about right at the moment. But then for more informal conversations and also for stuff within that week, everyone we support has one care professional who's their link worker, and that's the person they would talk to. So if they're worried, and we have noticed there's been a lot more phone calls, more emails from family and from the people we support. It goes with that comment about being lots of change, and so their point to call is their link worker, to say, oh, actually, could we have an extra visit, because the person who normally does normally comes in on a weekend can't visit, and the link worker would say, yeah, let's check in let's see what we can do that. Yes. But then when it comes to, for instance, if the invoice is different, because we're regularly adding an extra weekend visit, then they would speak to the central team and say, could you sort out the invoice to this person? They don't sort out pricing and billing. They do the cool stuff, the interesting stuff.
Yeah, the fun stuff, some might say.
Yeah, exactly.
So in terms of information about coronavirus and COVID-19, where have you been looking for the information around that?
Oh, yeah, Greg, there's so much information floating around, isn't there? We're trying to use official sources. Public Health England, so the government website, because that's what we need to adhere to, and we want to take clear guidelines from them. We have also looked at the WHO website, and I found that sometimes there's a bit of ambiguity in some of our government's advice, and you're just not sure. But then for some very specific things, like the use of face masks, how to use PPE properly, we found some brilliant, really useful information on the WHO website. So that's been great. And then for more local stuff, we're in the Thames Valley area, and in Oxfordshire, there's the Oxford Association of Care Providers, OACP, and they've been brilliant actually for this, and really helped with sharing what's happening in our area. So those are our main sources. I'm trying to steer clear of social media and things that may be spreading false information. I think that's probably the best advice we can give and take ourselves as well.
There's definitely a lot of that. Yeah, definitely. So from the kind of information side as well, how have you been, first of all, how have you been sourcing PPE? That's a massive, massive question and a massive concern for most of our agencies. So how's that been going for you?
So I think we were quite proactive. So basically we started early. As soon as we realized that the virus was here and before it had become an issue, we thought, okay, we need to plan for worst case scenario. What if someone we support develops coronavirus? What would we need to keep them and our staff safe? So we sourced PPE early on, which meant that actually we had masks being delivered when the government was looking at delivering the allocation of 300 masks per care provider.
Yeah.
We had our first lot of 1,000 masks arrive before that. So so we've right from the start, our approach to PPE has been to get it early, to have at least 1 month's supply of PPE in stock. And it's got harder and harder. We have tried everything. My co-founder and COO she's done an amazing job, but it's taken a huge amount of time. She started off using the typical usual supplier and medical suppliers, but more recently, and actually I asked her prior to this call, she said that the most reliable for her has surprisingly been eBay. Things have arrived on time and actually as promised, whereas we've had another delivery which was supposed to come from a medical supplier, which didn't arrive. When we complained, it turned out they hadn't received their stock yet, and yet they'd taken our money. So and eBay, we haven't had any of those issues. So it's only one provider's experience, but it might help to add that. There's also, we saw on Twitter, there's I believe it's a not-for-profit called SOS. It's sos-supplies.com, and they're coordinating logistics between providers, between different suppliers. So you fill in a form to say what you're short of, what you need, and they will search for you and try and arrange it. And they provided some stuff for us a few weeks ago, so that may help other people.
Yeah, that's a great link. And I think, people that are doing this are definitely kind of key in making sure we can get the right PPE, because as we know, there is a shortage. I mean, luckily for you started early, but a lot of care agencies may not have done, or, they may have found that suddenly a lot of people had COVID symptoms, and that means that they just didn't have enough supplies. And now you have this panic and scramble to make sure that you can get the most of them. So I think eBay and the sos-supplies.com is a really, really good tip. So don't worry, we'll be sharing this after the webinar, and I'll send all the links around, and everything we've talked about will be written up, so you can access this later on when you need to, or share it with whoever you need to.
Some creative thinking, just keep asking contacts of contacts. I've empathize with people who are finding it difficult. It's taken an inordinate amount of time for us to find what we need.
Yeah, if anyone who's on the chat right now listening, if you have any tips for finding PPE, or if you found a great source, please do share that, and we'll make sure to share that with everyone else who's joined us today as well. Like I said, this is collaborative, and I think we're all looking for solutions at the moment, so please do share that. The next question I have for you, Trudie, is how have you communicated to clients about the use of PPE? Now, I asked this question because when we held our webinar with Claire Sutton the week before last, there was a lot of kind of questions around, what if a client wants me to wear a mask, or doesn't want me to wear a mask, or doesn't understand? So what have you been kind of saying to them about this?
Yeah, it's tricky, isn't it? Because we've had both of those situations. So we've made sure that all our care professionals have masks, because you never know, they might arrive at someone's house and find that they've got symptoms. And some of the people we support feel much happier if our carers are wearing a mask and or staying distant where they can prior to any personal care. And so if that makes them feel more comfortable, then we will. But we've had other people who really don't want us to. One lady who we support has been deaf since birth, and she lip reads. So actually, a mask is is tricky. And we've talked about what we would do if somebody who lip breathes needed care and was showing symptoms. And we've seen a homemade invention where they put a clear plastic bit in a mask. But I think probably the most challenging situation is for the people we support who are living with dementia. And so what we've always said is that the team have decided that when they arrive at someone's house, they usually, even if they've got access to the key, they'll usually ring a bell or make sure if that's appropriate. So they'll say hello at a 2 meters social distance, and then they'll say they've got a mask. So if the person wants them to wear a mask, then they'll put it on. If they don't, then they won't. And if that person's not showing symptoms, then the government guidelines is we can do that, and they can put the mask on if they're close to doing personal care. So we're trying to make sure that we explain that every time to someone even with dementia, because they may we're finding we're having to re-explain why somebody can't leave their house and why these masks are around and what the problem is, and it's difficult. I mean, it's hard enough for the rest of us to get our head around this invisible virus completely and utterly changed our lives, turn them upside down. And so I can completely understand why some of the people we support are getting quite distressed, and that's why, supporting them and doing what they want is doing what's going to help them feel comfortable is the most important thing.
Definitely, I think that's a really good tip as well, making sure that if you do have a client with dementia, that you're always announcing that you're going to be wearing the mask, or making sure they're aware, and that's really definitely useful for care providers all over, I suppose.
Yeah.
I'm just going to jump over to one quick question here because it fits in with what we're saying. This is from Carla. She asked, Trudie, do you think these changes will be permanent, e.g. the use of PPE? And that's really interesting. Do we think that beyond COVID, this is going to be something we need to be sort of thinking about all the time?
Yeah, well, it's not like we're going to get to one date where the government are going to say that's it, it's all over. It's not going to be a sudden end. It's going to be a gradual change. So there'll be some significant milestones along the way, like as and when various restrictions are lifted and people can start going back to work, and then life will feel more normal. But actually, in the group that we're supporting, they're going to remain at risk because and until we have either a cure and or a vaccination, the virus is still here. So even if, say, next winter, when people are working more normally and traveling more normally, this virus is still going to be around. So actually, I think PPE is going to remain very important, because that's going to be our only way of limiting the spread of a pretty nasty virus.
Yeah, I think that's super interesting to think about that. We're all kind of hoping for this end date, and actually there may never be an end to what we were used to. It's going to be completely changed. And I suppose that's also important for care providers to get thinking about their lines of supply nice and early, getting them in now so that in the future they always have, options to make sure they've got enough PPE, because like you say, this is going to be a challenge forever now.
Yes.
Which, definitely something to think about there. So thanks, Carla, for that question. That was great. On sort of not quite PPE, but similar to the idea of COVID, how many staff do you have at the moment that are self-isolating or they're out of work? Has that been a challenge?
So at right now today, we've only got two people off work self-isolating. So one, she has a vulnerable person in her household, and she's been really worried. She wanted to work. She didn't want to let the team down, but actually, after speaking to her family, they've agreed that actually she's not going to work for the while coronavirus is still at a peak. And then we've had someone else who had a cough and a bit of a temperature last week, so has quite naturally spent 7 days off. And we've literally just before this call, we wondered if we could get her tested, and our initial reaction was, it's going to be really hard. But my co-founder is amazingly tenacious, and she said, well, I'm just going to Google and see what I can find out. And she's managed to find local to Oxfordshire a testing place that's been set up by a philanthropist, and they've agreed to they can give her a test for coronavirus. They're testing frontline staff, starting with GPs, but they've agreed to give her a test. So actually we can be a bit more definite. There's still a lot of questions though, because people are testing positive for quite a long time after their symptoms have gone. So following government guidelines, she would be okay to go back to work after tomorrow. But if the test comes back positive, then she may self-isolate for longer, and we need to talk through, and there's a lot that's not known. So yeah, working this out as we go, but try and find out where local testing's going. If that's care staff are just as important as NHS staff, and we need to get those tests to our people.
Yeah, I wasn't even aware that they were doing that, so I think that's a really good piece of advice. If any care agencies or care providers are struggling with self-isolating carers, then do have a look and see if there's anything in your local area, because it would provide such peace of mind to know that, you know, it's not COVID, or you know, even if it is, but when we get some more information about self-isolation, if you are testing positive, it just gives a bit more clarity, I think.
Exactly. So she wasn't particularly poorly, but she had a cough and she had a temperature. So it could have been coronavirus, but she didn't feel particularly ill, so it may not have been. And and she's desperate to get back to work, but we need to make sure we're keeping our elderly people safe and delivering a high quality of care.
For sure. Now, sticking with kind of staff, we were talking about here, staffing and recruitment is a massive challenge at the moment. You know, we've seen that a lot of people have been out of work, and then there's been shortages. So what are the biggest challenges for BelleVie for recruitment during COVID-19? So at the minute, I suppose. Yeah.
Well, interestingly, so we have seen an increase in the number of applications, which is positive, and we think that's linked to people losing jobs in hospitality and retail, and we're very keen to recruit people from a non-care background and train them. As long as they have the right values, then we can provide training. But it's been massively challenging. The difficulties that we've had is we've had several good people go through the process to near the end of our process and then drop out because of family pressures. The families don't want them working and delivering personal care during this time because of the risks, and they've been great people, and then they say, oh well, perhaps in a few months' time could I come back? And it's like, well, yes, but that's been quite tough to deal with. We're very proud of our training investment in people, but it costs us a lot of money to get someone trained up, and so we really want people who are going to stay with us, not just for some temporary work for the next few weeks. So that's another challenge, but predominantly it's finding people that are the right people and are willing to work in these difficult circumstances. And it's hard. We're asking a lot.
Yeah, for sure. There's a question here from Charmaine. She said, "There's a shortage of labour in the care market. How do you overcome this?" Now, I think, you know, there is, but there's also a lot of workers who, like you said, may be out of work. They may have worked in hospitality. I suppose that's another route in. But how are you personally addressing that shortage of labour?
Yeah, so Charmaine's completely right. So that was a problem before coronavirus hit. And with 10% vacancies across the care sector, we realised fairly early on that actually that we were going to need to recruit from outside of care. And then when we were exploring the self-managing practices, and we're working with wellbeing teams, or a partner who we partnered with last year, we learned from them that actually some of their, I mean, they typically would take 70% of their recruits from a non-care background because it was easier for them to work in the self-managing teams. So if you've been used to one way of delivering care, then our way of care can feel really different. And as human beings, most of us find it harder to change than to learn something. So so it's one of the reasons we put a lot into our people and training. So I think the answer is for all of us is to look outside. There are lots of sectors at the moment. Even prior to coronavirus, retail was struggling to survive, and lots of people who come from that background were losing jobs. Jobs are being automated all over the place. Now there are amazing people there who are caring and compassionate. It doesn't matter that they haven't done the right training courses yet. If they've got those innate abilities, then let's find them. Let's show them how worthwhile this job is, that we all know, but not the picture that's painted in the press. Let's tell a different story, the real story about how we put smiles on people's faces every day, and use that to recruit people who want to find a sense of purpose in work, who want to give something back to their local community, and who have the right values, become amazing care professionals. Bring them into our wonderful sector, train them up, induct them to our new way of working, and that's how we solve the recruitment problem. It's how we solve the care crisis, and it's how we support our growing older population.
I think that's amazing, and you hit it right on the head there. At the moment as well, we have a lot of people who are willing to help, and they do want to help, so we should be harnessing them. I have a question here from Carla. She actually asked two that are about recruitment, but I'll ask the first one. She said, how do you provide training from someone coming from retail, for example? Can you train them online, or does it have to be hands-on? And that's obviously really, really critical right now to COVID.
So before coronavirus, we did a mixture of face-to-face and online training, and the face-to-face was really important because typically that's around how your behaviours, how you'd act in situations and scenarios, and both from providing great care, but also to working in a self-managing team where you're expected to be proactive and take responsibility for resolving problems and not just go to a manager somewhere. And so we also had a suite of e-learning courses as well. So we've extended our e-learning course, and actually we've had another team that has just recently gone live. So we had all their induction plans with external trainers coming in to do sessions, and we managed to move that all online. So it was video calls with the external people, so the same thing, and we used Zoom, and the breakout rooms in Zoom were really good because then the teams could go away and work on exercises and then come back, and then combine that with your traditionally your standard e-learning courses where it's just you and a computer. So that's been a really good experience because we'd recruited that team. It was a team of 6. We'd found them all and done face-to-face recruitment workshops. Then coronavirus hit. We moved the whole of their induction online. I think if you'd asked me a few months ago, could we have done it online? I'm not sure. I'd have, because we had to. We did. It worked, and stuck to dates. So that's so it's possible, but you've still got to keep that human element, and then you get the learning.
We had a question as well from Kim saying, how did you do your moving and handling training online?
Oh yeah, so then the new team actually, where everything was 100% online, has been a bit different because they're supporting a family with a couple of young adults living with complex autism, and so the requirements are quite different. It's more about supporting these young adults with their behaviour, and we haven't. There's the moving and handling element isn't there, so we haven't worked out how to resolve that for our teams that support older people. We have found some e-learning courses for moving and handling. What we would probably the other thing also kept face-to-face is shadowing, so that's really important. And if someone has only done e-learning and they've come from, I think someone else mentioned, if someone's come from a retail background, we would have to do more one-to-one with somebody as part of their shadowing, but that then is deemed work. So we're okay to do that, whereas the guidelines are that all the training has to be done online. So I think that's the way we get around that. But so far, our current new recruits for our elderly teams have come from a care background with valid training. So
that makes a lot of sense. I think there's, you know, a lot of questions around recruitment, and people know they're needing to do it, and they know that they can do it online, but then, you know, you have things like moving and handling. And then another question here says, what about first aid training? You know, there's so much that previously would have been face to face. This is a whole new challenge to overcome.
So first aid training is a good example, because that's a mandatory requirement for all our teams. And so now there's lots of online courses for those. So what we've decided is that everyone does the online course, but then as soon as coronavirus restrictions have lifted, then we will do a big group face-to-face course, so they can actually practice CPR on a dummy and all the rest of it, which we think is, and we've also changed in the system we use to track our training logs. We've put a shorter expiry date if someone's done an online first aid course, rather than the 3-year time limit we have on a face-to-face. So I think that's one way of mitigating the risk, where an online course might not deliver quite everything, but it's still better than nothing. And then remembering that you've still got the very human elements of being able to ask questions of your peers and your register manager for any areas that people are struggling.
I think importantly there as well is what you said about when you have shadowing or, you know, a group first aid training, that's considered work. So you can bring people in to do these things. And that's a question that I've seen quite a lot come up from our agencies. You know, can I still offer shadowing? Am I allowed to? And if it's work, then yes, that would be the right move to do.
Yes. So we pay people as if they're working. So effectively they start work for us, but they're shadowing, and then it switches so that they'll be leading with somebody shadowing them to make. So that's how we'd make sure that, and we would do that anyway. But I think that's probably more important now we've got all training online. But one thing that would be great to hear is if and perhaps this group can share, if you find some amazing e-learning courses, particularly for those where we'd normally all advocate to be face-to-face, then I think we need to celebrate those courses and share them, because I don't know about everyone else, but we're spending a long time hunting out different courses from different providers.
Yeah, definitely. If anyone has any they've used or any they've heard about, put them in the chat for now. And if, you know, in the future, if you find any, do feel free to send them over to Birdie, and we can share them out, or even to Trudie. You know, tag us on Twitter, and we'll make sure that we get that shared. Like I said, the whole point of this at the moment is we're all learning from each other, and we're all collaborating.
Yeah.
So thank you for sharing the recruitment side of that, Trudie. That was really, really interesting. I'm just going to switch over to our next question, which is about contingency planning. Now, we've mentioned a few things. You know, a few members of staff have been out, and I suppose contingency planning in recruitment is about moving online. But what else have you been doing at BelleVie to plan, you know, to contingency plan, I suppose?
Yeah, well, we had a business continuity plan that was mainly for snowy weather, though, which tends to be over and done with a little bit faster than a global pandemic. But that gave us a really good basis for working out how to risk assess everybody that we support. So the most important part to our contingency planning was to go through everybody we support and look at how we supported them, how critical their needs were, and then also to look at what other support networks they had around them, so family or other people who could provide support. And in looking at that, we then prioritize people, so that if we end up drastically short-staffed, we know where we can, well, we never want to, we know where we can cancel a visit and it's not going to put someone at significant risk, or where we can ask family members. And we communicated that to members early on, saying if we're really stuck, we might ask you, so that we can prioritize people who are completely by themselves. So that's been really important, and to do it calmly before things hit. We also, the central team, have arranged a daily COVID call so that we could stay up to date with government guidelines, talk through where we're at with PPE, make quick decisions if someone needed to self-isolate. That was important. So yeah.
I think, yeah, there's so much we could be doing. But I mean, have you got a plan for the worst case scenario? That sounds quite morbid and awful, but it's probably something that we could definitely be sharing.
Yes, yeah. So we've talked through worst cases and what we do. We've also realised that our scenario planning is likely to change when we get to a situation. It'll depend on who the person is, and so we've talked about. So we'd go back to the risk assessment we'd already made, and work out what we can and can't do for that person. There's different worst case scenarios. So if someone we support developed coronavirus, then we would carry on supporting them. But how we'd do that, how we'd work with the health teams, primary health teams, and we've made sure that everyone's got the right PPE. We'd look at dividing the teams into having kind of a clean team that didn't visit that person and visited everyone else, and try and keep it as limited to 1 or 2 people visiting the person who was showing symptoms. We'd try and get them tested if we can, but we'd need to work assuming that we couldn't get them tested. And then the other worst case scenario is if our team was drastically struck, and then it would go back down to the prioritising the people with the most need and the least support around them. We know there are some cases where, for instance, someone who's self-isolating but healthy can do what we call distance care. So we've identified those people, or actually a phone call to prompt them to take their meds is the most important thing that we need to do if we physically can't get to see them. Yeah. So let's do that. And while we're there, the distance care plans can include the really vital companionship, and to try and mitigate the risk of us not visiting as much as we were. So yeah, those are the sorts of things we've been talking through.
I love this idea of like distance care planning. I think that's something that, is really, really useful, and definitely something that I think we should be sharing and doing more of, because it kind of keeps in mind that sort of person-centered care, even from a distance.
Yes.
So just kind of finally on this point about contingency planning, how are you managing to still maintain that quality of care, given the limitations, given the distance? How are you overcoming that?
Yeah, so we're definitely doing more phone calls. We didn't previously do many phone calls at all, but sometimes it's been at the person's family request that they've been worried about us visiting, but also know that visits are appreciated. So having phone calls only. We're looking at we've got so providing tablets, and we're trying to set someone up at the moment, a lovely lady we support who's living with dementia and is missing all the visits from her neighbours and friends, and so we're trying to set her up with a tablet and an internet connection, which she doesn't currently have, to see. And we're the only people visiting her, but if we on those visits can teach her how to video call people, that would be a real difference. But first off, we need to get internet now. So those sorts of things. And then an idea which actually we're talking to Beth from Birdie about, shopping is increasingly more of a challenge, and we can no longer nip and get a pint of milk and a loaf of bread for someone quickly between visits, because you have to queue, and we don't really want, the team don't want to be spending any longer in supermarkets than they need to. So we're looking at whether we can do more online shopping for people.
That's amazing. I think, yeah, definitely keeping that sort of level of connection, even if it's distance, is key for making sure that you're giving the right person-centered care, and making sure that even a really isolated older adult still feels supported.
Yeah,
there's some really good tips. Thank you for sharing those. The next question I have is one around mental health, and this is something that's come up a lot. And I mean, people all over the world, not even just carers or NHS frontline staff, everyone is struggling with mental health given the situation. So from BelleVie's point of view, how are you supporting, yourself and the team, and also your carers with their mental health given what's going on? Yeah,
it's tough, isn't it? So the team have got the Oxfordshire team have got their team meeting right now, and I think that's been a really important part for them to offload, for them to share. last week, sadly, someone who we've been supporting for quite some time, and the team are very fond of, passed away, not of coronavirus. There's still all the other ways that all the other diseases around. So actually last week's team meeting, which was the day after she passed away, they all toasted each other with hot chocolates, which was her favorite drink, and took some time in that team meeting just to share good memories. So I think that those video calls are really, really important to them. The team meeting's only weekly, so on Slack there's a channel called Check-in, where you just check in with how you're feeling. So it's not a transactional conversation in there. That happens. There's other channels for that to happen. Just people talk about how they're feeling and get some supports and empathy from their colleagues, and that's proved really valuable. So encouraging communication. And then we've just had an offer from a lovely lady who ran a course for us on nutrition last autumn, and she's also a yoga instructor, and she's offered to do some free online yoga classes every Tuesday evening. Amazing. So I'm going to be joining in that with a few of our team as well. And I think she wants to share it. So she's offering it free to anyone with health and social care. So perhaps I'll send you some more information. Amazing. You can pass that on.
Yeah, that would be great. And I can follow up if anyone feels like they want to get involved with some yoga. It's definitely a great way for calming your mental health, I think.
Yeah.
I think your tips there on Slack were really useful as well. Some of our agencies obviously won't use Slack, but even a WhatsApp check-in in your groups to just say, how are you doing today? You know, something to sort of remind people that there is support there without, you know, needing to be so structured is a really, really great way. So thank you for sharing that with us. Now, moving on to this one. This is kind of to round us off here. What are your top tips for home care agencies? You know, not just at the minute, but in general. If you could share those with us.
Yeah, well, I suppose so top tips, and as a tricky one, but perhaps the most important thing is just how we behave. So to stay calm. You know, the world isn't going to be like this forever. To stay calm so that we make rational, objective decisions, and be kind. You never know how other people are affected and what their particular worries are. And if we all stay calm, then we'll get through this in better shape. The second top tip is to risk assess everyone you support, and ask your care professionals for contingencies. So they're people who know best. So what are the other options if you're incredibly short-staffed? What are the other options for making sure that person is well supported? And plan assuming that you're going to be, that around 20% of your staff are going to be around for the next month or two because of a proportion of them self-isolating. And if you plan for that, then you'll be in good state. And third is to take time as a group, everyone in your organization, to reflect on sadnesses that happen, or to celebrate the good things, the positives that happen. So like the hot chocolate that I mentioned. And on the Thursday evening clap for carers, we've all hooked up, the people who weren't on shift hooked up on a Zoom video call, and we all had a glass of something in hands, and we cheered each other whilst clapping out of our windows and doors. And that was a really great way of bringing people together and just reminding everybody of how amazing they are and what an amazing job everybody's doing at the moment.
I love that. I think that's great, and that's something that I think we should implement that at Birdie too. You know, we should definitely all join in with that together. So I love that.
Give it a go this Thursday.
Cool. So the last question, Thursday we're going to do it.
Excellent.
Last question I have for you is, how is Birdie helping with COVID-19 and with the general management of your agency?
So we'd moved to Birdie not long before this happened, and I'm pleased that we're all set up and using it. But it's the Birdie for us has been, the interface is so simple and straightforward. It doesn't cause any issues. It just works, which is the best feedback we could get from the team. The the positives, so it helps us do our job, and ultimately it means that our carers spend more time caring, which is what we all want. And at the moment we're struggling for time and dealing with this change, so we need the carers to have more time caring. And the fact that Birdie are so helpful and have offered to support us in other ways, and adapt to what's happening to us, has just been brilliant. So it's much appreciated. Thank you.
Oh, no worries. Thank you for being on board with us. So what I will do before we go to the Q&A, I know there's a few questions that we're going to get to at the end. I just want to run through just a couple of things from Birdie's side, how we're helping directly related to COVID-19. Now, I'm going to do this quite quickly, so if you want any more information about these, drop a message in the chat box and we'll make sure that we get you that info via email. So the first one that we've launched is our viral symptoms checklist. Now, this just allows carers to easily record any symptoms of coronavirus within the app. If there is a symptom, then the care management team will get alerted instantly, and then you can then record how you respond to that. So the actions you've taken, whether it's updating a care plan or sending more information about PPE, however you respond, you can then record that following this viral symptoms. And you can do this viral symptom checklist on every single visit. The next one is the RAG status. Now, this kind of ties into what you were saying, Trudie, earlier about contingency planning and making sure that all of your clients, you're assessing them based on their need. Now, we don't set what a red, amber or green means to each care agency. It's up to them to decide. But basically, the way we've seen care agencies use this is a green status would be clients who are appropriate to have their visits reduced or replaced by a phone call, or even postponed if needs be. Amber for those who have fewer visits than usual, and red if someone is really, really in need. Now, this just helps you see at a glance in the agency hub who has those needs, and where you can change your care plans accordingly. And the next one to mention is Birdie also has an in-app carer message. We've seen quite a lot of love for this since we launched it. And this is basically just a banner that shows up on the carers app. Now, you can change this to be anything you want, but at the moment we launched it so that you can relay important COVID guidance, whether that's reminding your care staff to wash their hands before a visit, or any important updates to do with, what's going on at the moment. You can obviously then change this message to whatever you want it to say and change the color. So in terms of importance, so red, I think red is on the screen. That's the most important one. The next one is our newest addition, which is the COVID-19 hub that we've just launched. And this is where we're collating all of our articles about COVID-19 and all of the learnings that we're getting from these webinars, from our industry partners, things that we're working on. And you can go here and filter through all the content we've got there. And basically, it's just a place to find information that's from trusted sources, without any jargon. So hopefully it should be a really, really simple and easy place to find information. I'll share the link with you all to that after the webinar. And the next one to mention is, you've probably seen it, we're offering Birdie for free to new care agencies. Now, the reason we're doing this is because we know that our software can really, really help care agencies during this time. And sometimes, they just need to kind of get on board and reduce those barriers so they can start working remotely immediately. Now, we're just rolling this out while coronavirus is obviously happening, just so we can help get this solution into the hands of the people that need it most. So that's just our email, our care logs, and our family app. And there again is a link, which I'll share with you after if you want any more information about that. Cool, that's my pitch over. Now I'm going to jump straight into the Q&A. And there were a few questions here that we missed while we were talking, and they just kind of didn't fit in with our conversation, so I thought I'd just save them to the end. Now, one question that I saw was directed at you, Trudie, here from Natalie. Are your team meetings on Zoom or Skype? We were using Zoom, but I heard there's been some problems with confidentiality.
So the team meetings were face-to-face before coronavirus. We've been using Google Hangouts for the team meetings, and we believe that they are the data, the conversations are secure, but it's tough to know exactly. But we knew that we had to. I don't know if there's any difference between the different providers. So Google Hangouts is we're we're using at the moment. We've used Zoom in other situations as well, and I believe that should be fine. But I definitely get advice from a data protection officer, which I'm not.
Cool. So the next question I have here is from John. With regards to PPE, there are some guidelines to sewing face masks. Is this something you would recommend? If we had a staff member that's a decent sewer but currently at home self-isolating due to risk, not virus contamination. So I suppose the question is here, sewing face masks, is that something you would recommend?
If you can get face masks that have been made for the purpose, then that's got to be your first choice. If you physically can't find those, then my personal preference would be that a homemade face mask is better than no face mask if you're with someone who's got symptoms. But first choice should always be, and at the moment there are masks to be found. I think the only thing that's really hard at the moment is gowns, but actually in our scenario in home care, that would be a rare end. I would keep hunting for those masks.
So like I mentioned before, if you weren't here for the webinar the week before last, we covered all kind of aspects of PPE, how to use them, where to find them as well. So I'll share that with you guys after this webinar, because there is some tips on homemade PPE and kind of the risks around that and what you should be doing. So I'll make sure I share that. Now, another question I have here is, so Ravi has answered this on the chat, but it just might be good to kind of explain it from a care point of view. So the question is, what is Slack? And we use Slack in Birdie, but this might be new to care agencies who are listening. So I think maybe just explain a bit about what it is and how you use that in your setting.
Yeah, sure. So Slack it's just a communication tool, but it's been around for a few years. I think it's about 10 or 15 years now. And it originally started to help businesses deal with overflowing email inboxes. And as you know, emails still a predominant form of communication. And the guys who founded the Slack company felt that email was a pretty inefficient way of communicating, and that there could be better ways. And that's how Slack was born. It's all designed around the users, lots of user testing. They put their customers at the heart of everything. So it's an incredibly efficient, intuitive comms tool. The good news is that there's a free version of it, so you can sign up for the free version and give it a try. The disadvantages of the free version is that you'll only ever be able to see the last 10,000 messages in that instance of Slack. So you can't use it as a store of all messages, but if you just want to use it to chat to your team, then it's a great way of doing it. And you can have different, they're called channels, and so you can set up a channel with a certain name. So we've got a channel called Rota, and we'll talk about the Rota changes in there. I mentioned that we've got a channel called Check-in, where you check in about how you're feeling, so it keeps those things away from transactional stuff. So you might perhaps, I think lots of people are using WhatsApp at the moment, so you might have a WhatsApp for your team or your provider, but all the conversations are all mixed up in one. So it's like having lots of WhatsApp groups, but all together, and it's secure. So you haven't got to worry about that. It works well on your phone and your computer. So yeah, I've been a fan of. I've been using it for ages, years, and love it. But yeah, give it a go yourself and make your own mind up.
Like I said, we use it here at Birdie, so in the follow-up email, I'll send a link to Slack so you can all check it out. We highly recommend it.
Yeah, I should get commission. I've been recommending Slack for a decade, and I haven't got any vested interest in it.
I'll definitely share that with everyone. Now, I think the final question I have here is, when carers come back from holiday abroad, how long before they can return to work? Now, I think this kind of fits in with the self-isolating thing. I mean, I don't think many people will be holiday abroad at the moment, but I suppose there are some questions in that, like you said about your own carer who was off with symptoms, and it's the 7-day thing. So how have you been kind of
Yeah. So right now, well, the travel restrictions have been longer than 14 days. So nobody should be coming back now from holiday. And prior to that, it was if they'd come back from an at-risk country, then they needed to self-isolate for 14 days. So that was the length of time, and now it's 14 days if someone's been exposed to somebody with in their household that's got symptoms, because it might take a week for symptoms to some time for the symptoms to show. And if you yourself have symptoms, then the government's advice is 7 days from the first day that you showed symptoms.
That's really useful. Again, I will send some more guidance in the follow-up email from probably from Public Health England or Gov UK with those specific things in there. And obviously the links are being updated all the time, so do make sure that you check.
Yes, definitely.
So that's it from all of our questions. So I suppose we are bang on 1 hour. So all that's left to say now is thank you everyone who joined us today. Thank you for your questions. I do hope you found it useful. And thank you, Trudie, for joining us today. It was really, really insightful. And it's really great to share these learnings between us all and open up that collaborative platform. So Birdie's Twitter and all of our handles are on screen for you now, plus those of BelleVie. And I'm sure if you want to get in touch with any of us, then you can indeed do that. I'd be more than happy to take any of your learnings or any of your feedback and collate those. And like I said before, we'll send a full write-up of this webinar, plus the slides, any links that we spoke about during this session, so you've got those to hand. And of course, if you have any feedback for me, then please do email support@BelleVie Care or email back to the email address that you've got the webinar link from. And yes, that is it from us. Thank you again, Trudie, for joining us. It was really, really useful. Everyone else, please stay safe and stay well and stay inside. And I do hope you'll join us again for our next webinar. But yes, thank you very much. It was great to talk to you.
Thank you very much. Great to talk to you too.
See ya. Bye.
Bye.